Corlia, and before I begin, Corlia, can I take the opportunity to extend my deepest sympathy and those of my party colleagues to our comrade David Culnan and the wider Culnan family on the death of their mother Berna, who has been laid to rest in Waterford today. Our Yesjay Gurwanam Jeelish. Taoiseach, in just over a fortnight's time, members of the INMO are due to commence industrial action with a series of 24-hour work stoppages over the coming weeks. Members of the PNA are also due to commence industrial action with a 3-day stoppage due to take place from the 12th to the 14th of February. And we all know that strike action is the last thing that nurses, midwives and medical professionals, for that matter, want to undertake, Taoiseach. But these people believe that they have been left with no choice but to undertake such action, given the ignorance, the arrogance and the ineptitude of you and your government colleagues in relation to dealing with the crisis that we now face. You have had years to address the recruitment and retention crisis in our hospitals, and we see how this is crippling our health service, but you have completely failed, and the situation has deteriorated year on year and month on month. Nurses, midwives and their unions have continuously sought engagement with the Minister for Health as well as with the Minister for Finance to address the problem of staff shortages as well as the issues of pay to avert the industrial action that we're now facing into. But their concerns have been routinely ignored by your government. In fact, what's happened is they've been verbally attacked, they've been threatened and they've been insulted as they have tried to go about achieving a resolution to a crisis that is crippling our health service and is impacting on so many of our patients. It is the staff of our hospitals who have acted with responsibility and in a mature manner. However, you and your government have decided to disengage. Taoiseach, nurses and midwives deserve our full support in their demand for a better health service that treats them as essential, skilled workers with dignity and with value, and I and my party give them that full support. However, your approach has been to dismiss their concerns, and industrial action is now the regrettable outworking of your government policy and that of your minister as you go ignoring the issue of the recruitment and retention crisis in our hospitals. For years now, nurses and midwives and their unions have put forward sensible proposals to try and address this issue. Last year in April, we in Sinn Féin passed a motion in this House calling for the introduction of recruitment and retention measures based on realistic proposals which would prioritise pay. It was supported by the majority of deputies here in this House. This motion called for the work of government to work with unions to draw up a roadmap for full pay equality with an implementation plan to deliver pay equality within a short time frame, not the 8-year time frame that you have offered. So, Taoiseach, at the 11th hour, will you now concede that you have failed to tackle the recruitment and retention crisis in our health service? Will you accept that this issue needs to be addressed? And will you commit to proper engagement with the staff, with the nurses and midwives, with their unions, and give them the fair deal that they deserve? A deal that means that all parties have to be around the table, including the Minister for Health and including the Minister for Finance.
Taoiseach.
I think, Deputy, the difficulties in recruiting and retaining healthcare staff, including nurses, are very real. They're certainly not unique to Ireland. The same problems exist in places that pay much less than us, like Northern Ireland, and places that pay much more, like the Middle East and Australia, for example. It is the consequence of an international labour market in which there's a shortage of healthcare staff. But you shouldn't give anyone the false impression that that doesn't mean that we're making progress. The number of nurses employed in our public health service in the past 5 years has increased by 3,330. And if you compare year on year, and it's important to compare month with month for seasonal reasons, the number of nurses working in our health service in November 2018 was 860 more than in November 2017. That's up 860 in a year, not including student nurses. So those are the facts. People could be given the impression that there are more nurses leaving the profession and leaving the country than there are nurses going into the profession and coming into the country. That is not the case. We have 3,000 more nurses working in our public health service now than we had 5 years ago, and recruitment will continue. I am very aware that two of the 3 nursing unions have decided, or at least voted for strike action. The votes and the ballots were very decisive, 95% voting for strike action, and I think that reflects the depth of feeling that nurses and midwives have about their pay and conditions. And we in government don't think for a second that the nurses are anything other than sincere in the action that they are proposing to take. And we will try to avoid it. We will do our best to avoid it. There's an engagement today involving employers and unions. There will be a meeting involving the Oversight Committee of the Public Sector Pay Deal, and that will include the Department of Public Expenditure as well as the Department of Health. That will happen on Friday. And then, of course, there are other options, including the Workplace Relations Commission and the Labour Court. So we will do everything we can, reasonably, to prevent this strike from happening. But we do need to bear in mind that there is already a pay deal in place. A pay deal agreed not just with nurses and midwives, but with all public servants. And that pay deal runs until 2020. And it wouldn't be fair or affordable to offer a special deal for one group in the public service and then say to every other group in the public service that we've no money left for you. Now, that wouldn't be right. That's why we do collective agreements collectively with ICTU, and that's the right way, I believe, to manage public sector pay. And we shouldn't forget what's involved in that pay agreement. In this year alone, 5 different ways in which a public servant's pay can increase. An across-the-board pay increase in the autumn, a special pay increase for those earning under 30,000 has just kicked in this month, a reduction in the pension levy, a special increase for new entrants in March, should that be agreed, and also an incremental pay increase for most public servants over the course of this year.
Deputy Doherty.
Minister Taoiseach, the recruitment and retention crisis is very, very real. And you can just talk to frontline staff, people that you blamed for causing the trolley crisis over the Christmas period, but I'm sure you got the wake-up call from all their tweets as they posted their pictures of them working on Christmas Eve, Christmas Day and New Year's Eve. But the reality is that it is a very real crisis. The reality is that we have 1,754 less staff nurses than we had in our hospitals a decade ago, despite an ageing population. The reality is of students that are going through midwifery and nursing at this point in time, 71% of them are saying that they are considering immigrating. The reality is that 60% of nurses that were recruited in last year, or 2017, were migrant nurses. And the reality is that our nurses and midwives are not paid enough for the work that they do and the pressures that they are under and that the care they provide. So what we need is a pay deal. What we need is for you to give effect to the motion that Sinn Féin put forward and had support in this House last April, which was to deal with this issue and to deal with the pay constraints that are on nurses, to make sure that we deal with an issue where we don't have only one application for every 4 vacancies in our health service. You talk about inefficiencies. This is one of the greatest inefficiencies, that we are not staffing our health service properly. And therefore we have a trolley crisis, we have a recruitment and retention crisis, and we have the spillover effect in that, where we have numerous people now on waiting lists growing and growing month on month.
Taoiseach.
Deputy, we can only deal with this issue in the context of wider concerns and wider issues. There are lots of people working in the public service, 300,000 of them, doctors, teachers, Gardaí, people who work in this House, civil servants. They all work really hard. And there are lots of areas in our public service now where we're finding it hard to recruit because we're approaching full employment. Indeed, that's the case now across the private sector as well. And we can only do things within the constraints of a limited amount of finance. We balanced the books last year, just about. But to concede to this and all of the knock-on claims which would inevitably follow would require us to pay for it through borrowing. And I don't think it's prudent or right or sensible in the long term to fund pay increases with borrowed money, because that inevitably will turn into a pay cut in 2 or 3 years' time. And those are the kind of policies that Sinn Féin would pursue, and that is where you would lead us. You would offer people, just like in places like Venezuela, you would implement socialist policies. You would blow all the money in the first couple of years, and after that, it would just be austerity and austerity and austerity.
Thank you, Taoiseach. Deputy Joan Collins, please. Deputy Doherty, you're finished. Deputy Joan Collins, please.